Hi class, this is Emily Moore, and I'm happy to have this opportunity to present on MOOCs, massive open online courses in medical education. Today I'm going to start by giving you a little background on my topic, which is massive open online courses or MOOCs. Next I'll talk about the literature, the interview I did with a medical education expert, and finally the implications on current research and the usefulness for future research. David Cormier of the University of Prince Edward Island is credited with coining the term MOOC. MOOC is a term that can be applied to any course that is taught online, aimed at attracting large numbers of participants, and open to anyone willing to enroll. In 2008, George Siemens, along with his colleague Stephen Downes, created one of the first MOOCs hosted by the University of Manitoba. Students in this course were encouraged to make online learning connections using various technology tools for the purpose of constructing knowledge together. Meanwhile, Stanford, Harvard, and MIT began to create their own MOOCs, which more closely resembled traditional courses, with online lectures as the primary means of instruction. Stanford's first MOOC was launched in 2011, and Harvard and MIT, in a partnership they call edX, joined the MOOC field in 2012. Which was declared the year of the MOOC by the New York Times. The earliest studies on MOOCs in medical education were published in 2011, but MOOCs are still an emerging phenomenon in the medical education field. Medical educators are considering MOOCs because some researchers have deemed the current means of medical education lacking in terms of efficiency, flexibility, and learner-centeredness. Educators are also searching for ways to use technology in medical education because of the increasing recognition of the differences in learning styles between learners of different generations. All of this has led to the question that I researched. Can MOOCs significantly impact medical education? To find out, I started by looking at the MOOC literature. If we look at this literature, we'll see that there are four main areas for potential impact in terms of MOOCs: recruitment, access, continuing medical education, and patient education. According to a study by Mehta and Associates in 2013, there is a shortage of medical personnel on the horizon. So for this reason, schools like the University of Sheffield in the United Kingdom are trying to recruit students, particularly disadvantaged students, to the field of dentistry. The University of Sheffield School of Clinical Dentistry created a Discover Dentistry MOOC for the purpose of recruiting students. This course was open to all, and it was accessed by over 4,000 learners from all continents and 79 countries. About a third of the people who took this MOOC reported that they took it for higher education purposes, and about 10% of the applicants to the dentistry program at the University of Sheffield said that they had participated in the MOOC to help them learn about the career of dentistry. The College of Nursing at the University of Texas at Arlington also used a MOOC as a recruitment tool, and they did this by offering a free introductory course for registered nurses who were interested in earning a bachelor's degree. They had over 70% of the students in their course pay to enroll in a second course. So this shows that free MOOCs could entice students to enroll in fee-based MOOCs as later courses. Another project, which was a partnership between the Association of American Medical Colleges, Khan Academy, and the Robert Wood Johnson Foundation, was proposed to increase diversity in medical schools by providing a free online preparatory course for the Medical College Admissions Test, or the MCAT. So this is another way that colleges and universities are looking to use MOOCs for recruitment. In addition to their potential for widening the recruitment net, MOOCs hold possibilities for reaching underserved populations. In Taiwan, for example, online continuing medical education lectures are making it possible for populations previously prohibited by distance and cost to access current and relevant medical training. For areas like sub-Saharan Africa, with about 10,000 patients to every one physician, bringing increased access to medical education through MOOCs might be especially important. Another way that MOOCs offer the potential to increase access is through increased access to experts. Duke University's School of Nursing has partnered with a for-profit MOOC platform, which is Coursera, to offer a nursing course to over 15,000 students. This MOOC was created as a non-credit interdisciplinary course that was just designed to help students enhance their skills in medical problem solving. The University of Pennsylvania has a similar course for clinical nurse practitioners, and this course is taught by an expert in vaccines, and it gives participants first-hand access to the most recent developments in the field and the top experts in the field. Probably the most widespread use of MOOCs in the medical field currently is for continuing medical education, or CME. As budgets for travel are cut, MOOCs offer a less expensive, more convenient alternative. I found examples in literature of several organizations that are already embracing the idea of CME MOOCs. The Canadian Association of Radiologists has endorsed the idea of MOOCs for continuing medical education, especially for underserved areas. The American Association of Colleges of Pharmacy has issued a policy statement supporting the use of new models of teaching and learning, and specifically mentioned MOOCs as a possible means of earning education units. And in Norway, doctors and nurses are learning together in an interprofessional dermatology MOOC that has proved to be a successful means of bringing professionals together for continuing medical education. MOOCs could also be used for patient education, including videos, discussion boards, and patient reminders. Other researchers suggested that it would be possible to use MOOCs to help patients with health decisions and questions that they might have. And there's actually an online community created through a MOOC to help people form connections, patients to form connections with each other. In the Netherlands, there's a program called Parkinson Net, which has created an online learning community with ongoing patient education that is supported by professional societies. And there's also some evidence that patient education MOOCs, including MOOCs designed to teach about contraception and nutrition, could provide future potential for use of MOOCs for preventative medicine. I was fortunate enough to be able to interview Duke Medical School Graduate Medical Education Program Coordinator Honor Sanderford for my project, and Ms. Sanderford provided me with many insights about how MOOCs are affecting medical education at Duke and how she envisions their impact on the future of medical education. Ms. Sanderford does believe MOOCs, combined with community outreach programs, might help increase the numbers of minority students who become interested in medicine and set their sights on Duke. She also believes that Duke will continue to offer MOOCs like the one I referenced earlier, the one that they created with Coursera, as long as such courses continue to prove successful. Ms. Sanderford sees much potential for MOOCs as CME tools, and she told me that Duke would probably be attracted to the potential cost savings in terms of reduced travel for physicians. She thought that physicians themselves would probably be attracted to being able to set their own schedules in terms of completing their coursework. Although Ms. Sanderford is not aware of any current use of MOOCs for patient education at Duke, she is optimistic about the chances that the organization might be involved with using MOOCs in this way in the future. When we look at the implications on the current research, we can see that there are both advantages of MOOCs for medical education and disadvantages as well. So when we look at advantages, we can see that because online learning is now a well-established means of completing coursework, MOOCs are able to use many of the best practices for e-learning that have already been developed and tested. Many of the advantages of online learning obviously apply to MOOCs, and that includes the ability to make learning individualized and continuous. MOOCs may also help educators better match the learning styles of younger learners, and some medical educators are intrigued about the possibilities of MOOCs in the medical field to standardize procedures and quality. So, although not all MOOCs are designed with the capacity to allow learners to connect with each other, some MOOCs do have this capacity, And these MOOCs bring additional benefits to users, including the ability to build an interactive network with fellow medical practitioners. And that would just sort of set those types of MOOCs apart from more traditional forms of e-learning. For Ms. Sanderford, the biggest strength of MOOCs in terms of the medical students that she works with daily is that they offer the opportunity to revisit content in a way that traditional lectures do not. So Ms. Sanderford envisions students replaying or rereading course material to increase comprehension. In general, the potential advantages of MOOCs make them an attractive option for Ms. Sanderford, and she plans to consider ways to incorporate MOOCs into the established educational programming at Duke. On the other hand, there are some definite challenges to MOOCs. One of the greatest of these challenges is ensuring MOOC quality. Ultimately, it's unclear if MOOCs will be able to bring the same level of quality, especially in teaching interaction with patients, as face-to-face coursework. Another issue that must be taken into consideration, mainly for the MOOCs used for continuing medical education, is evaluating student learning. And although some people have suggested using a system of digital badges, it's not really clear how such a system would guarantee that course completers are responsible for all of their own work. Another challenge is that because MOOCs are generally free and open to the public, it's not unusual for them to see really low completion rates. But if medical organizations are clear about their objectives, this statistic might not be an issue because reasonable course completion goals could be established. Another challenge for MOOCs is funding. So future funding is definitely an issue because initial funding for MOOCs is usually provided by grants or some other temporary funding sources, and finding the resources to continue to host them, promote them, and maintain them can definitely be a challenge for an organization. For Ms. Sanderford, the disadvantages of MOOCs or the challenges of MOOCs that most concern her is getting physicians to change their current methods, because in Ms. Sanderford's experience, doctors want to see empirical evidence of success before they adopt a new practice. This leads us to the usefulness of this research for future research, and there are two specific areas of priority that have emerged from my study. The first of this is future research on patient MOOCs. And a first step in terms of this research might be to research completion rates and collect data to determine whether students were actually completing these MOOCs. Then also in combination with learning whether students were completing, at what rates are they completing, is there evidence of patient learning? So are they completing, but also are they learning what they're supposed to learn from it? As well, patient satisfaction surveys are an important element because these could really give some more qualitative data if you had open-ended questions to allow patients to provide input on what their needs are and whether MOOCs are meeting those needs. Future research is also needed in terms of finding evidence for the effectiveness of MOOCs, since we know this is something that Ms. Sanderford mentioned was very important in terms of whether organizations would want to invest in MOOCs. It's really difficult to find any studies that directly address course outcomes for medical education MOOCs. So there's little empirical evidence of success or effectiveness of MOOCs in general right now. And this is in part due to the relative newness of this learning format. So even though it can be difficult to compare success rates in traditional courses to success rates in MOOCs because of the differences in enrollment, medical organizations are probably going to need some evidence that MOOC success rates can justify their costs before they really embrace MOOCs. So these are areas that certainly merit future research in terms of MOOCs in medical education. So although more evidence is certainly needed, based on my research and interview with Ms. Sanderford, I can conclude that the answer to the research question I started with, can MOOCs significantly impact medical education, is a resounding yes. It will be interesting to see how MOOCs affect the future of medical education and the way that organizations communicate. Thank you for learning about MOOCs and medical education.